Good evening. Thank you very much indeed. Welcome along. Please do take your seats and make yourselves comfortable. We've got a very busy house here tonight. Thank you very much indeed for making your way in so quickly. Just a hand up at the back if you can hear me okay. Good stuff. Lovely. Okay. Welcome along to the WE Innovate Grand Final Showcase. You are in for such a treat this evening. I am delighted to be your host. My name is Raya El Salahi, and I'll be taking you through what is set to be a really brilliant evening. So WE Innovate, as many of you will know, is Imperial's flagship program designed to champion the next generation of women founders and help them turn their bold ideas into impactful startups. What sets WE Innovate apart is a clear mission to close the gender gap in entrepreneurship. And despite growing interest in startups, women are still underrepresented. WE Innovate tackles this head-on with expert mentoring, with tailored support, and a powerful community that helps women to grow, lead, and thrive as founders. This year marks the 11th anniversary, and with that, we have great news to share. I'm really proud to announce the launch of WE Innovate National, Imperial's bold new initiative to take this program UK-wide. And we're delighted to welcome Queen's University Belfast as the first partner institution. Welcome along. Together with QUB, we've helped support an additional 25 women-led startup teams this year. Really impressive. And today we're delighted to introduce the next wave of partners joining the WE Innovate National Network, representatives of whom I know are in the room, at Durham University, Swansea University, and the University of Glasgow. A very warm welcome to representatives joining us here this evening. So looking ahead to the future, and Imperial's goal is to expand the WE Innovate National to 7 universities, and in doing so, supporting 175 women-led startups every year across the UK. And in order to make that happen, Imperial is actively seeking funders, partners, champions, that may be someone in the room right now who believe in the power of women entrepreneurs. If that is you or someone you know, please do speak to the team. You'll find them during the networking event this evening after the awards, standing by the Enterprise Lab banner. That's the big banner in the main networking reception space. So please do have a word with them later on. Okay, moving on. To mark the launch of WE Innovate National, we're doing something really special tonight. For the very first time, our 5 Imperial finalists are joined by 5 finalists from Queen's University Belfast to compete for a share of each institution's £30,000 grand prize. That's a total of £60,000 in awards up for grabs. And over the last 6 months, these teams have taken part in an intensive program of masterclasses, of business coaching, of mentoring. And tonight, you will hear from the really impressive final pitches as they compete for the grand prizes. Now, over the course of this evening, you will also hear details of bonus prizes. We have additional prizes for standout founders and teams who have reached the semi-finals of their programs, and details of those to come a little later this evening. Let me introduce you to our distinguished panel of judges. Each year, WE Innovate welcomes a fantastic panel of judges who, between them, have really diverse, varied, and extensive knowledge. And tonight, we're thrilled to welcome 5 incredible judges. Let me start with Alexis Derard St. James, an investment professional, founder and managing partner of Merian Ventures, a US-UK venture capital firm. Alexis, as many of you will also know, is the founder of the Althea Foundation and an original champion of the WE Innovate program. Alexis, welcome. Also joining our panel of judges is Professor Dame Ottoline Leiser, Chief Executive of UKRI, Regius Professor of Botany at the University of Cambridge. Welcome. And the third member of our judging panel this evening, June Angelides MBE, a venture partner at Samos Investments, angel investor, Oxford University mentor, and a passionate advocate of women in tech. June, welcome to the panel. We also have Erica Brodnock, MBE, an award-winning entrepreneur, multi-award-winning entrepreneur, founder of KinHub, angel investor, philanthropist, driving inclusive innovation across the UK. Erica, great to have you with us. And our final judge on the panel this evening is Nigel Toon, an AI entrepreneur, investor, author, and engineer with a track record as CEO of not one, not two, but 3 successful venture capital-backed companies. Nigel, great to have you with us. Now, I know you're all keen to get started. Just one final point to share before we do, a really quick word on safety. If the fire alarm goes off this evening, and there is not one expected today, please do make your way out of this room using the emergency exits at the back and front of the lecture theatre. These are the doors with the green exit signs above them, and please do so as quickly as you can. Okay, all of that out the way, let's get on with things. It's time to meet the 10 incredible teams competing tonight. Just to give you a sense of what's to come, each team has just 3 minutes to wow us with their pitches, and that will be followed by a tight 3 minutes of questions from our fantastic judges. And once all the teams have had their moment, the judges will step away to deliberate, and then we'll find out who is taking home our grand prizes tonight. So, with no further ado, let's get started with our first pitch of the evening. Please put your hands together and give a very warm welcome to Gracie from Reporty. Thank you.
For the last 2 years, I've been traveling the world, speaking to hundreds of people about nightlife safety, trying to get to the bottom of this. Half of adults feel unsafe attending live events, and this means the industry could be losing out on up to £3 billion and 44 million event attendees in the UK alone. If you imagine you're a security guard standing right here in this crowd, something awful could be happening just rows in front of you, and you may have no idea. And that is the problem. Event staff can't be everywhere at once, and assaults, violence, and injury, if unreported, can turn into fines, reputation damage, lower revenue, and even venue closure. The cost of losing a venue license is upwards of £1 million, and new counter-terrorism legislation fines of up to 18 million. We validated this with over 50 industry experts throughout WE Innovate, and it really shows that safety isn't just a moral problem, it's a bottom-line problem. Now, this is where Reporty comes in. It's the first real-time crowd reporting platform for live events, and essentially means from anywhere within a venue or a crowd, you can get out your phone, scan a QR code or connect to a link, and speak directly with security and safety teams and receive real-time feedback. It works without app downloads or mobile service and is 60% faster than current reporting methods. This provides value by increasing staff capacity, offering life-saving advice, and supporting with compliance. We've been able to validate our B2B tiered subscription model throughout WE Innovate with stakeholders like Westminster Council and Camden Market. Now, the UK event sector is valued at £70 billion annually, and with a 500 million serviceable market, we'll be looking at the London market in the next 12 months. Whilst on WE Innovate, we've put pilot testing agreements in place with Camden Market, Roundhouse, and Unlocked. We've raised over £63,000 worth of investment and awards and developed an MVP that we've tested with over 100 users. We've been Tech Nation Rising Stars finalists and shortlisted for awards like IF Student Design and Deutsche Bank Creative Entrepreneurs. Now, whilst I'm a solo founder, I'm by no means alone. I've got 2 brilliant new team members and an amazing advisory panel, including the former head of security at Virgin Atlantic and the commercial director for the 2012 Olympics. Now, 1,500 to 5,000 today would support with marketing and onboarding for paid pilots later this year. 7,000 would help us expand these paid pilots to Manchester and Bristol, and 15,000 would help us to extend our current developers contract and bring on a security expert. My name's Gracie, I'm the founder of Reporty, and we're building the emergency button for the crowd. Thank you.
Gracie, well done. Really difficult being the first one to go, so congratulations on that. Well done. Let's take our judges' questions now. And Alexis, starting with you.
Thank you. To Great idea and very timely. Obviously, we need this.
Thank you.
So 2 questions, quick
Yes.
one. What do you do that's different than your competitors? So
100%.
how did you isolate this idea versus another idea?
Mm-hmm.
And what is the response time when someone activates, I need help?
Yeah, absolutely. So I'll start with the response time. So from our test, it's taken under a minute from when people report something through pressing all of the buttons. We've tried to make it as intuitive as possible to then it being notified. This summer will be the first time we're actually connecting people in a crowd to the control room. So this has been a controlled environment that we've been testing this, but we're hoping that that follows through. In terms of competition, there's no one really tackling specifically crowd reporting. So you have kind of 2 types of competition. You have internal management software, which will be large stadiums, large-scale events. Every single security guard or medic might have an app in their pocket and they can internally report in. And these systems might have crowd reporting functions, but they haven't really looked at the design and the user interface and how to make it as easy as possible for the people who are reporting, but also the people who are responding. And that's what kind of sets us apart, is that we're really looking at making this user experience as slick as possible for people who can be in really stressful situations, and then make it as easy for the people who are also in stressful situations responding to this. And what's more is it works without mobile data and without any app downloads, which none of our competitors are doing at the moment.
Great.
Yeah.
What does good look like for the business in the next 5 years?
Growth, sorry.
What does good look like for the
Good.
business?
Oh, okay. Good looks like. Well, we're hoping to launch by the end of this year, which is quite ambitious, but we're hoping to have our first kind of working prototype that we'll take out into the world by July, so pretty soon. And then launch by the end of the year, trying to scale to around 70 to 100 venues next year. And I think then the following year, we'll be looking to kind of target multi-venue operators and larger scale events, so festivals, starting doing some pilots with them, and then trying to get into stadia. We're then going to be looking to expand internationally. There's a really big market in Europe, as you can imagine, Germany and Spain, massive markets, and also the US. There's some crowd legislation coming through too, which also poses, like the new counter-terrorism legislation in the UK, a really good opportunity for us.
Ottilie? Any further questions?
What is the business model? Have you got a sort of clear idea of the licensing or how your business
Absolutely.
model works?
It's a tiered subscription model, so it's based on capacity of the venue. And what we've kind of broken it down to is this new counter-terrorism legislation. There's 2 tiers to this. So you have the standard tier, which is anything between 200 to 800 capacity, and they're going to have to prove that they've got better crisis management planning in place. But 800 plus, you're going to actually have to do another layer to this. And so we're breaking it down into tiers within these. So it'll be based on the capacity of the venue as to how much you pay. We're still ironing out pricing, but it's looking to be from about £250 per month up to then £5,000 for larger festivals and stadia.
I'm afraid that brings us to time. Thank you very much.
Brilliant. Thank you so much. Cheers.
I don't think I've ever seen anyone quite so happy for their Q&A to be over, but let's move on quickly. Next up, we have the founder of Dainty Grace. Please give a very warm welcome to our next picture of the evening, Sarah.
Hello, everyone. Growing up, I struggled with the insecurity about being small-chested, not just because of stereotypes, but because I couldn't find bras that fit. And I spent years wearing ill-fitting bras that left me uncomfortable and self-conscious. Then I learned the truth about bra sizing, and it changed everything. There are widely held beliefs about cup sizes. A is small, C is medium, double D is large, and it's led many to believe that small-chested women must only be double A, or B. But that's a myth, and I'll tell you why. Cup sizes aren't one size fits all. They vary depending on the underband size. So as you see here, a 30D is much smaller than a 38D, despite sharing the same letter. So many small-chested women actually need C, D, double D, or even E cups paired with smaller underbands like 26, 28, and 30. Mainstream brands don't offer this, while niche brands are still pushing the A cup myth. Millions of women are left unsupported, literally and emotionally. My name's Sarah, and that's why I'm launching Dainty Grace, a lingerie brand offering smaller underbands with proportional cups. And it's more than products. I'm building a community, the Dainty Darlings, where small-chested women can feel seen, supported, and confident. I'm working with one of the UK's top lingerie manufacturers who's helping me bring Dainty Grace to life. So far, I've bootstrapped 4 wireless bralettes, an underwire bra, and matching underwear for each, all produced here in London. I'm growing an Instagram community. I'm growing an Instagram community, sharing bra sizing education, and it's already generating into a wait list of ready-to-buy customers. And I've also gained key validation from the Bra That Fits community on Reddit, with 576,000 women who are frustrated by this exact sizing gap. This is a huge opportunity in a multi-billion-pound market, yet it's still being ignored by most brands. Dainty Grace's global potential, especially in Asian markets, where many women are smaller busted and often overlooked. My model is direct-to-consumer on Shopify, starting with bras and sets, and with plans to expand into swimwear and lifestyle. And I'm also growing a loyal body-positive community, creating network effects that drive organic growth. And long-term, I hope to be stocked in premium retailers like Selfridges. And I have lived with this problem for over 2 decades. And I'm working with Maxine, who has 15 years lingerie experience in the industry, and Jamie, who has 15 years international sales and go-to-market experience. I'm incredibly grateful to the WE Innovate program. It's given me clarity and sharper storytelling. The grand prize will fund my first production run of 300 to 400 units. Sorry, I'll just stop here. What started from insecurity has grown into something empowering, not just for me, but for countless others. Dainty Grace isn't just a brand, it's a movement, one where small-chested women are finally supported literally and emotionally, just as we've always deserved. So.
Sarah, well done. Let's take some questions from the judges now. And Ottilie, let's start with you.
So it's a very exciting market, I agree, but you highlighted the Asian market. Are there, do you need to segregate that market? Are there different products that you think will work differently in different countries because of the different
Not necessarily. Cultures? I think just the Asian markets, just genetically, they're more inclined to be smaller-chested. So my small-chested designs will cater to them, and the Asian market makes up 40% of the entire lingerie market. So there's real potential there.
Thank you.
Alexis.
So I'm so hugely impressed, and I want to join the revolution. So,
thank you.
I think you've identified a large problem that affects at least 50% of the population, and that's large. So I want to say well done. This is something that's very, very hard to talk about, and I seldom see founders address this because it's a difficult thing to talk about. So well done you. And I wanted to ask one question that when I see something like this, it's very manufacturing intensive. So where would you manufacture? Where would you source?
Well, I've been keeping everything within the UK to start with. I'm working with a London-based studio, and I've been sourcing all my fabrics in the UK for sustainability as well. The studio that I'm working with also has a partner factory in Europe as well for larger production runs, but small production runs are possible here in London. And that's where I'll be starting.
So you mentioned the fact that most mainstream brands aren't really picking this up, but who are in fact your competition?
So there's really 2 main competitors I suppose I could talk about. There's a US brand called Pepper, but they really lean into the AA, A, and B cups are the only small sizes, and they also don't offer the smaller underbands that I will be offering. And in the UK here, there's the Little Women, it's called, but they only offer AAA, A, and A cups. So they don't offer the smaller underbands or the fuller cups that small-chested women need.
Okay, that brings us to time, I'm afraid. Thank you very much indeed.
Okay, thank you.
Okay, that brings us on to our third pitch of the evening. Please give a very warm welcome to the founder of ClearXview, Renee.
I'm Dr. Yang Gu, founder of ClearXview, an AI-powered imaging solution to improve orthopedic diagnosis, starting with the knee. Knee osteoarthritis is more common than you might think. For people over 40, 1 in 4 are affected. But in the UK, getting a clear diagnosis is still a major challenge. This is because after seeing a GP, X-ray is the only imaging modality available for diagnosis. It's 2D, lacking details to detect early changes. Patients often go through up to 5 repeat scans across 6 months to confirm the diagnosis. And after all that time, 41% of patients are still misdiagnosed. That's 350,000 people each year in the UK living in pain and stress. It's costing NHS over £2.5 billion a year. ClearXview takes the same process, but uses AI to reverse engineer the 3D bone structure from X-ray. This reduced the diagnosis time from months to just 1 day, using a single scan, and improved the accuracy from 59 to 90%. This could save the NHS £400 million a year by avoiding unnecessary scans and long delays. What enables us to achieve is our unique data that work across the real-world patient populations. We are setting a new standard. ClearXview is the first to offer 3D clarity from 2D X-ray with high diagnostic accuracy and clinical versatility. Through WE Innovate, we've refined our market strategy and business model. We are now focused on the global diagnostic market for knee osteoarthritis, valued at $1.7 billion. Our business model is a £120,000 annual subscription for UK hospitals. Over time, we aim to scale ClearXview to support the diagnosis of other conditions that rely on X-ray. This innovation builds on over 15 years of research within the team. With the help from WE Innovate, we've interviewed over 150 clinicians, formed a patient advisory group, and secured early traction from one meta partner. As the founder, I've brought together a team of experts in AI, meta innovation, and healthcare delivery to reach our first reflection points in May 2026. The WE Innovate Prize will support us in engaging 5 more clinicians for product testing and feedback, critical for our regulatory strategy and patent applications. ClearXview is here to change the way we see X-ray, bringing fast and accurate diagnostics accessible to everyone, everywhere.
Renee, well done. And we'd like to invite your team members on for judges' questions now. Okay, starting, June, with you.
Really great progress. I love what you're doing. Maybe I'd love to hear a little bit more about your go-to-market strategy. What markets do you think there's a big need for this product?
It's a global need because X-ray is the screening tool for all the orthopedic diagnosis in the world. So we are targeting the global market initially, but right now we need to complete the validation in the UK with our collaborating sites, Charing Cross Hospitals, and with the validations and our network, we aim to bring this product to the US next year. That's why we are racing for the first capital raise.
Does the product need approvals, like FDA approvals? Or,
Yes.
So that's quite a big hurdle to get through, right?
Yes, but we are building a class 1 medical device, which means it's lower risk and also quicker to market if we're going for the FDA compared to the standard medical device.
So June asked about your go-to-market strategy. I'm really interested to understand who's buying this already, if anyone, and whether you have any letters of intent or anything like that to say that you could actually turn this into a business where people would pay for it.
Definitely, can I invite my team member to answer this question?
I'll start. So I don't have a microphone. Well, okay, I'll speak. I used to give lectures in this lecture theatre. So yes, so we have orthopaedic surgeons and radiologists who are part of the team, but also who we interact with and who are potential purchasers as individuals. But of course, the real strategy is to do it through the NHS. And for that, you have to get sort of bulk purchasing agreements. And so we're investigating that now. But we need thought leaders, and those are the ones we've got on board.
Perfect, thank you.
Okay, that brings us to time. Thank you very much indeed. Well done. Our next team to pitch for you this evening is brought to you by Kira, the founder of IASO Solutions.
Did you know that 1 in 6 people suffer from mental health care conditions globally? That's almost 1 billion people. We're living in the middle of a mental health crisis. Debilitating conditions like depression, anxiety, addiction, anorexia, and post-traumatic stress disorder are debilitating our communities and our loved ones. The current treatments just aren't effective enough. For people with PTSD alone, only 20 to 30% of those achieve full remission. So what's the alternative? Psychedelic-assisted therapy. It's a therapeutic approach to mental health care using compounds like psilocybin, MDMA, and cannabis. It helps rewire the brain and helps the patients gain insights and process difficult emotions. So they're showing real promising results with those conditions. My name's Kira Reynolds. I'm a global program manager. I have 20 years of experience in the startup and the software industry. I'm a scientific board member at Psychedelic Care EU, which is the first citizens initiative for the mind, launched in Brussels on February the 6th. I'm a graduate of psychedelics, altered states and transpersonal psychology, and I recently presented my research at Breaking Convention in the University of Exeter. Even with the promising results of psychedelic-assisted therapies, we still have issues. There's a lack of data and research, a lack of effective screening, a lack of digital health records, and a lack of personalised interventions. So what's the solution? IASO Solutions. We're a data-driven healthcare platform combining the latest scientific research with unique genetic, biological, and psychological profiles to provide individual treatment plans to patients. We combine psychedelics, science, and innovation from screening to script. This is a look at our dashboard for the healthcare professionals where they can track their patients, they can schedule the appointments, and they can review the treatment plans and can be updated based on real-time information fed in from the patients. This is a suggested monthly pricing model. We have a core system, and then we have additional add-ons. Our target customers are medical cannabis clinics, psychedelic therapies, and pharmacies. Our key features are the targeted interventions, expert-trained AI, and the data collection. The future of the markets, I'm actually looking at Australia and Switzerland at the moment. By 2026, the market is 8 billion, and the growing market by 2032 in Switzerland is almost 40 billion. These are the legal territories. These are increasing all the time. The dark blue is where we have legal psychedelic-assisted therapies. And just last week, the Czech Republic was added to that. The WE Innovate program has been incredible. I've been able to set up my company in Belfast. I've designed my MVP. I've defined my business strategy, the identity, and the business model. We've built a community in Belfast. It's definitely built my confidence. I have 2 potential clients. I'm pitch ready, and the money will go into the development of the MVP. The next steps are to refine the customer requirements. I'm going to the Global Psychedelic Conference in Colorado next week. The next step is then to develop the platform and then customer acquisition. We are the team. That's the QR code for Psychedelic Care EU, if anybody would like to sign that. And then we are IASO Solutions, transforming mental health care recovery through psychedelics, science, and innovation. Thank you very much.
Kira, well done. Let's take questions from the judges. And Erica, starting with you.
That was a really good pitch, very strong, and really interesting work that you're doing. I'm interested to know kind of how you've been received in terms of price point. Are you ever going to direct to consumer? Is it always going to be a B2B model? And then what's the kind of feedback on price?
Yeah, so great question. So I have potential clients to meet in Colorado at the Psychedelic Science Conference, so I'll check those. We haven't built the product yet, so I need some more customer feedback on that. But yes, it's absolutely, I'm going to have a connection to Spotify so that people can use that in B2B, but I want to get the medical model ready first before we can pass it on to B2B, because you need trained professionals to work with their, you just need some risk assessment around that.
How do you know the results that you see are repeatable in different people?
So, and that's exactly what we're doing. So we're collecting data. There's a lot of scientific research happening at the minute across the globe, and we're gathering data. That's what I've trained the AA model for. But it is repeatable by working with the psychedelic clinics at the moment, and then seeing what that repeatable, to track that data to see where there's similarities and if anything affects that. So that's exactly what we're going to be doing, is gathering that data.
Any further questions from our judges? Alexis.
Thank you. The need is great, as you highlighted. And I just have 2 questions, because I follow this closely in the States. One is, when you do the diagnostics, is it in person? Is it remote?
No, so the diagnostics, what we do is we actually feed in the genetic profile, and then I've trained that will be sent to a healthcare professional. Once they do that, then it'll be in person or over Zoom. There's a Zoom connection in there. So whatever is, because telehealth is really important as well. It's also addressing the cost. Psychedelic assisted therapy is very elitist at the minute. It costs between 15 and 30 grand for one person to get treatment. So, and that's because it's not ubiquitous at the moment. The Psychedelic Care EU initiative, we're trying to change that with the policies. But yes, we'll definitely be looking a hybrid. Okay. Yes.
And then just very, very quickly,
sure.
Supervision. Once the diagnostic is made and the dispensary is done, the supervision, is that done in person or hybrid as well?
Depending on what substance and what compound, but if they're taking anything, so for cannabis, that can be administered alone. It doesn't need any supervision in that sense. But if you're working with other compounds like psilocybin or MDMA, that would totally be in person. You need 2 therapists just to keep everybody safe.
Okay, that brings us to time. Thank you very much indeed.
Thank you.
Okay, and that brings us on to our midway point of the evening. Please welcome our next team to pitch. Give a very warm welcome to Lucy from Luna Bio.
Hi, I'm Lucy, CEO of Luna Bio. Imagine being told you can't have a child. That's exactly what happened to my mum. She went through IVF in order to have me. Every morning, she'd wake up and travel to the clinic for a blood test to monitor her hormones and ensure that the treatment would be effective. And this disrupted her entire life, since she had to take time off work, putting financial pressure on the family and a toll on her mental health. That was over 20 years ago, but still, nothing has changed. 3 million women undergo fertility treatments each year globally, and 52,000 women went through IVF last year in the UK alone. They require frequent blood tests, sometimes up to twice per day, to monitor their hormones and ensure the treatment will be effective. This is inconvenient, time-consuming, and costly for the women and for the clinics. That's why we're building Luna Bio, a wearable hormone biosensor that uses minimally invasive microneedles to monitor estrogen and progesterone, providing real-time data for clinics. Initially, we're selling to clinics at the device with a cost of £100 used for a 2-week period of monitoring, cutting costs back by 50%. This enables clinics to take on 40 extra patients per month and generate an extra £200,000 in revenue. The global market for fertility is huge, and initially we're starting with a UK market of 15 million. But beyond fertility, there are many other use cases here, including menopause testing, at-home consumer testing, and sports athletic performance monitoring. Through the course of WE Innovate, we did over 100 customer interviews. We are now in talks with 25 clinics across 12 countries to do pilot studies with. We've received 8 letters of intent from leading clinics around the world. And we received testimonials like this from the director of the leading clinic in the UK, that this will be a real game changer. WE Innovate has been a huge help for us throughout this process. The £500 from phase 2 was used to purchase reagents and begin lab development. And with the £15,000, we can continue to build our prototype, secure IP, and go through clinical trials to be on the market by 2027. Our team is comprised of biochemists, biomedical engineers, and electrical engineers from Imperial, and we're advised financially, technically on medtech design and biosensors, and clinically by the director of the leading clinic in the UK. If it wasn't for IVF, I wouldn't be here today. But with your help, we can give more women the chance to have something they've always dreamed of, the chance to start a family. Thank you.
Lucy, well done. And for judges' questions, we invite the rest of your team to join you at the front now. Okay, and for judges' questions, Nigel, we start with you.
Really interesting and exciting. The technology that it's based on, the blood monitoring piece, is that standard technology, or is that something you have had to develop, which is specific to your testing?
So we're looking at monitoring in the interstitial fluid rather than the blood, and that is widely used in continuous glucose monitors, which are adopted by diabetic patients all over the world. So we'd be taking that same level of monitoring, but instead of glucose, looking at hormone detection.
Moving along, Alexis.
Yeah, so again, I think I want to just echo what Nigel said. It's really, really interesting, a very important space. What I am thinking about is the barriers to entry. So you have a novel discovery, you want to apply for a patent, but can you talk a little bit about the technology and barriers to entry to prevent competitors from coming into the space?
Yes, so we've been talking to lawyers already, and once we begin our prototype development, we'll be securing a patent on the novel binding technology that's not currently being used by any competitors on the market. So that will be our unique selling point, and we'll be able to secure our patent for that.
Moving on, any further judges' questions?
The FDA testing or regulatory testing that you need to go through for this, what level of testing and how long do you need to pursue that?
Yeah, I'll invite my co-founder to answer that.
Yeah, thank you very much for your questions. So we are initially looking to target getting regulatory approval in the UK, since we're getting started in the UK and we've already built so many relationships with fertility clinics, especially including the leading fertility clinic in the UK, so the one with the highest success rates. He's told us that he's willing to do pilot studies with us to help us understand that our device would actually work and validate our technology. So we'll be looking to get approval from the UKCA, and it will be under a Class 2B medical device. So it would be because we would be helping influence decisions as well in terms of IVF timing and also dosage of the medication. And yeah, we'll target the FDA approval further down the line. So once we get the approval in the UK, as it's faster, cheaper, and more accessible.
With 8 letters of intent, have you already started to seek funding?
We've been focusing on securing funding in the prize for this, and we've also been looking at grant applications as well. We want to get a grant or some equity-free money to begin building our prototype first, potentially looking at angel investment as well, before then we go to venture capitals once we have that validation in the lab, and we'll be looking to do that later on down the line.
Thank you, Team Leader Viola. I think that's the time. Thank you. Okay, moving on to our 6th founder and startup to pitch for you this evening. Please give a very warm welcome to the founder of CME, Mary.
My name is Mary, and I can give you the gift of a lasting life. And this, well, this is Vincent, my godfather. It was while I was clearing out his house that I came across letters, diaries, and photographs that went back generations, that gave me a real insight into the lives of the people who lived there and their memories. Today, when I capture my memories, I grab my phone. I've got gazillion photographs. I'm drowning in them. But think about it, because all of our images, despite geolocate, people tagging, and date stamps, they lack meaningful backstory. We're creating colossal image dumps also, and with AI, we're maybe seeing the erosion of the authentic human story. But there is another way. CME, an AI-enabled personal archive platform that uses Lifebox and innovative narration tools that help to put the memories and feelings behind your image. Imagine if you could take a simple 2D photograph and turn it into a really rich, multi-layered archive, capturing not only your memories and stories, but those of the people you love, and then secure it for future generations. You can also curate the best and delete the rest, and pass on something that's navigable, capturing your story of a lifetime as you go. We're different. We're different because of story and community. We're a life box, not a death box solution. We do capture backstory, and we don't sell your precious personal data. We don't just look to the past, and we're not a snapshot in time. We're a SaaS subscription and license platform, B2B, for example, national institutions, and B2B2C, such as the care sector. This is a massive opportunity with 5.6 billion social media users globally. That's where we share our images. And we're targeting 1.5 million Gen XY, predominantly women, who want it for themselves and for their elderly relatives. The opportunity is huge. We're the dream team to deliver. I've 25 years senior public sector experience, managing multi-million-pound capital and revenue projects, including for national museums. Gordon's a certified ethical hacker, has used AI in highly regulated security-critical domains, and we've got an in-house and outsourced support team. We've got gaps in developers and fractional C-suite roles. And these are just some of our partners and advisors. We've got potential for societal change because we're capturing that authentic human story. Since we started in 2021, we've worked with TechStart, the Royal Academy of Engineering, Innovate UK to carry out fake door campaigns, and others. But whoa, in this programme, we've built our MVP, secured 29,000, worked with key partners that you can see here. And if we get the money, we're going to turn it into 100,000 for legals, cybers, those key hires, and to carry out beta testing to bring our MVP to market within the next 5 months. We'd love to talk if you can see an opportunity for CME. Thank you.
Mary, well done, and we welcome your team member to join us for judges' questions now. And Alexis, starting with you.
Thank you. It's a great idea. Could you talk a little bit about the technology? So you used your iPhone as an example, but I'm assuming that you have just plain photos that you would use the technology to upload and then store it in some ways. Could you talk about, like, from photo to archive?
Well, Yes and no. So we've been working with Matthews and Squire, and some of the wizardry and technology is actually protected. So we have built your own proprietary code. When we capture sort of your backstory, it's really important that we isolate that, and then we develop communities with sort of wider models where we've got reference and sharing. So there's a lot of stickiness in it. So one brings five. So we're looking at mobile, at web initially, but we want to move to iOS and Android. We've also got an advisor who's had 120,000 global employees who can see an opportunity for this to link into telecoms, to come across at source. I don't know if there's anything, Gordon, you want to add to that?
Maybe just on the actual data, this is obviously PII information with respect to GDPR. We've got to be very protective of that. Mm-hmm. So we are, in the way we're architecting the back end, etc., that's we're thinking of well-architected frameworks and the security aspects of that. We're going through a data process at the minute, defining our data and our data path and data storage.
Okay. That's really what I was getting to, so that's
perfect. We have an MVP built out now, so we're on about our 5th iteration prototype to be built now as MVP, and we're working with the Age UK and we've been piloting with the care sector and also with museums, and as I said, I worked with museums and was chair of GEM, which is Group for Education and Museums NI.
So, go ahead.
Go ahead.
The question I was going to ask was about retention. This is quite a long commitment that your customers are making. Yes. How do you ensure you retain them? Have you got any data on retention of customers?
From the very get-go, when we tested our first initial prototype with 100 users and we finished the test, initially they were saying, can we keep this going? How do we keep this going? And I think that whole idea of community is really, really important. So in CME, we have a series of life boxes. So, CME as an adult or as a child, or CME at school, travel, golf, fish, whatever it is. You're going to have very different communities within that. So that's very different to your current social media models, where you've maybe got one audience. So it's all about customization and categorization. And so that is going to ensure, I suppose, the longevity. So there's an awful lot of anti-churn guilt there, where when people have invested memory and feeling, and also I think it's that selection, where you're choosing the thing that means the very most to you from the get-go. Our price point is very reasonable. In terms of the B2B2C, we're looking at about £130 per year. So you're just looking at over £9. So in terms of other app subscriptions, if it's going to be, killing an app subscription, we hope that this is one that you're not going to lose. And in terms of white labelling with museums and galleries and the care sector, there's an incentive for them to make money as well. So we're very keen to do that, and there's a drop-down optional donation button, as well as getting a percentage of the sale.
I'm afraid that brings us to time, but thank you very much.
Okay, thank you very much. Thank
you. Okay, moving on, I'd like to invite our 7th pitcher of the evening to the stage. Please welcome the founder of Aeropod. It's Lou.
This is Aeropod, and we're leading the regeneration of humanity's most important resource. Soil is alive, but decades of intensive farming practices, like using heavy machinery to break up oxygen-starved soil and spreading chemical fertilizers, have left 40% of global soils degraded, expected to reach 90% in our lifetimes. But 95% of global food production still depends on soil. Farming isn't built for the future, and climate change is making things worse. With heavy rains intensifying soil compaction, preventing machinery use, and causing crops to rot, we're heading straight for a global food security crisis. Now, regenerative farming offers a way out, but rebuilding soil can take up to a decade, and most can't afford to wait. We need a bridge, a way to rebuild soil that's climate resilient without sacrificing immediate yields. And that's exactly what we've built. Aeropods are nature-activated capsules designed to respond under heavy rain and soil compaction pressures. They're planted alongside seeds, and when triggered, aerate and enrich soil, breaking through compaction without harming soil. It's quite literally groundbreaking. They improve soil health over time, reducing fertilizer dependency. And the best part, we're a novel platform changing the game by introducing agricultural inputs whenever needed. We're also 60% cheaper than traditional machinery
based methods. With precise aeration proven to increase yields by up to 20%, Aeropod's potential impacts are global and massive, outperforming existing methods on every single level. Now, soil degradation costs the UK £1 billion annually, and we're starting here, where regulatory mandates and strong momentum towards regenerative farming create perfect timing to scale fast, before we move to the US, EU, and Japan. With a significant cost incentive, we're extremely attractive to farmers, so our strategy is to sell the product per hectare through farm and grocery cooperatives in the UK, providing direct access to large-scale agricultural networks. Long-term, we're licensed through our patent. We're a team of passionate innovation design engineers with unique lived and domain experiences that make us the right fit for the job. And we're working alongside leading experts, partners, and advisors. We are moving really fast, and WE Innovate has played the biggest part. Now, every single stakeholder on our development pipeline needed to make Aeropod happen is on board. We've also just represented Imperial at Vienna and have just won this year's Ideas to Impact. Next stop, Osaka, where we'll represent Europe as global finalists at Expo 2025. We've partnered with YSF to pilot test and are also in conversations with global leaders, Mitsui Chemicals, to co-develop Aeropod. We need the 15K for our final round of intensive lab testing that sets us up for our first pilot in early 2026 with YSF. Now, even if we change our behaviors today, we'll still have 100 years of climate change effects ahead. So let's future-proof our most important resource with groundbreaking innovation. Thank you.
Lou, well done. We welcome your team members to join you now with a prototype for our judges to see as we move on to judges' questions. And for questions, Ottilie, we start with you.
Checking out my model here. Thank you very much. Really exciting technology. Where are you on the development cycle? You quoted very quickly some impressive sounding statistics. What's the system under which you've currently tested it, and what's your plan for larger scale field evaluations?
Okay, so I'll say we're technically TRL4. We're trying to get ourselves to TRL5. We've already put the prototype in the field and seen how it's able to break up soil. And in terms of our plan, we are partnered already with YSF, so it's a regenerative research farm in Nigeria that are based in the UK. And we've partnered with them because they're excited by the promise of the innovation, so they're offering it to us completely for free. And we're planning to pilot with them by early 2026. So right now, what we're trying to do is complete our final rounds of intensive lab testing before we do that pilot with them, and that's why we need the 15K.
Thank you.
Moving along the line to June.
Yeah, really, really impressive. I guess my question was around commercialization. What are, you've obviously got some incredible letters of intent. Where do you see this going sort of the next year?
Okay, so the incredible thing about Aeropod is that it's a platform technology. So we mentioned aeration, and we're tackling aeration because tilling is so bad for the environment. But it can be for anything, really. So we've spoken to some farmers because of WE Innovate, lots of different types of farmers. And for example, one of them is a fruit farmer, and he's more interested in pH level of his soil and making sure that those are regulated. We spoke to another farmer that's an arable farmer in northern England, and he said that there's a very challenging particular type of weed called black grass that happens in northern England and northern UK. And apparently, the cultural solution is to just try to wait out the weed before they plant, but especially with changing climate cycles, it's really hard to do that. So he asked if we could put the seeds into Aeropod and then have them deployed at a particular time. So you can start to see the amazing ways in which we can scale into almost anything that farmers need, really. So yeah, that's the plan for scaling. And also in terms of scaling, in terms of commercialization, we said that we're going through grocery cooperatives in the UK, and that's because they have incredible sway over the farms and their supply chain, because obviously they have to represent themselves in a certain way around ESG and all of that, and they're very interested in this technology because that would mean that they can reduce their overall carbon footprint. by not disrupting soil anymore, and also by reducing diesel, labor, machinery costs as well. So that's
a very quick question, because I know we're out of time. Would an organic farmer consider this an organic solution?
Yes, 100%.
Nice short question and nice short answer. Thank you very much. That means it's time. Well done to Team Aeropod. We are just going to take a short break now. I'm aware there have been a few technical glitches with the screen, so we're just going to try and sort that. And also, I can see many of you are feeling quite hot because it's warm in here. So we're just going to have a 5-minute break, a water break, and then get started again. Thank you very much. Okay, if you could return to your seats, please. We are going to get started again in just a moment, so please make your way to your seats and make yourselves comfortable. We're going to pick back up in just a moment's time. Okay, it looks as though most people are now back in their seats. Thank you very much indeed for bearing with us as we were sorting that out. I understand we have now got everything sorted, and so no further glitches, fingers crossed. But thank you for bearing with, and hopefully you got a bit of air, much needed air there as well. Right, let's crack back on, because we still have some fantastic teams to pitch for you this evening. And we pick back up with our 8th founder of the evening. Please give a very warm welcome to Rachel, representing Innovcope.
Hello, I'm Rachel Small, and I am co-founder of Innovcope. Just for a moment, I want you to imagine that you're going to play a game of snooker. But instead of a snooker cue, you've been handed a piece of rope. That is how learning a medical procedure called endoscopy has been described to trainees. Endoscopy involves passing a long, thin fibre optic camera into the human body to look for, test for, and treat disease. It's managed via a handheld device where micro movements at the handle result in macro movements at the tip. For gastroenterology trainees, to gain enough competence and to qualify to practice independently, they need to be supervised in the real world and on living patients, and it's not without its challenges. Here we go, thank you. We have seen a complete collapse in training opportunities in the last number of years, and when a training opportunity presents itself, the trainer is responsible for the safety of that patient. Meanwhile, they have huge waiting lists to get through. We've also seen an increase in adverse events for safety incidents for our patients. We've spoken to experts at a local, national, and international level who have all been enthusiastic about an innovative approach to solving this problem. You may think that that's a virtual reality or augmented reality solution. However, we surveyed 21 endoscopists, and they were all very clear that the VR models did not actually suit their needs, and what they want is a sensory experience. Innovcope offers a realistic alternative to practicing on living patients. Our device is portable, so it doesn't use up that valuable theatre space, removing pressure from all the lists are already under pressure. Our simulator can simulate up to 14 different procedures at the moment. Simulation-based education is an evidence-based approach to providing safe healthcare in a controlled environment. It's used globally, and it is expected to be a growing market. For us, we want to be a solution for one particular area to begin with, which is this training problem within the UK for GI endoscopy. But this has potential to go around the world. Thanks to WE Innovate, we have discovered a rich ecosystem in Northern Ireland that has given us networks and tools to make this a success. We anticipate that a B2B business model will suit this type of product. Our team is made up of 2 nurses who combined have 35 years in relevant nursing experience and healthcare education. We're also supported by colleagues in simulation and engineering. Innovcope was presented at a European conference last summer, and it received a tidal wave of interest. So we are ready to patent our first design at the end of the month, and we would like both funding and connections tonight to roll out a pilot program across the UK that would validate this tool and allow it then to have meaningful impact. Thank you.
Rachel, well done, and thank you for bringing us back with the 8th pitch of the evening. Right, time for judges' questions. And Jean, over to you.
Great pitch, and thank you for taking us through that journey. I'd love to understand a little bit more about the path to regulation and what that looks like and where you are on it.
Okay. In terms of regulation, it'll never be in touch with a patient as such, but to be able to be like a task trainer that could be a substitute for a patient, you would need to have a validated tool. Now, some of those accrediting bodies are looking at simulation as a solution, but we need that tool to be validated to be able to make that meaningful.
Okay, on to our next judge, Erica.
Great pitch. Thank you so much. So I'm really interested in whether you've got any hospitals on board that are willing to trial this with you.
In Northern Ireland, we have a private hospital who's very keen to work with us. Obviously, we need to get the patent organised and things like that, but we have a lot of consultants at home are interested. So yeah, that's why we'd really like that pilot scheme to go, and we would really like it throughout each of the regions within the UK. So we would certainly have one in Northern Ireland. We suspect we might have one in England, but we'd love one for Scotland, Wales, and the south of Ireland shouldn't be a problem as well. So if we can get that organised, then that should hopefully be a good solution, for this particular problem.
Moving on, Lee.
In terms of applications, you're focusing on this one approach to start with. More broadly, where do you see this basic technology going in terms of training in medical settings, but actually one could imagine various other settings as well?
Absolutely, that's a great question, thank you. So at the moment we're really focusing in on the GI model because that's our experience, but endoscopy is used for multiple bodily systems, up to 5. So really we would like our solution to be able to be, it would be a high fidelity task trainer in terms of simulation-based education. So, you could use that for a lot of different wraparound care around things that go wrong in hospitals. So it's not just about the clinical competence. There's all those other things that you could use it for. And that's how we would like to grow it. But at the moment, it would be a task trainer, if that answers your question.
Okay, that brings us to time. Thank you very much.
Thank you.
Okay, that brings us on to our penultimate pitch of the evening. Please give a very warm welcome to Madeleine, the founder of Sekmmet.
Good evening. I'm Magdalene, CEO of Sekmmet. We heal difficult wounds faster with a super plaster. Wounds like this. It's gruesome, but this was Dan's reality after a traffic accident. He endured 10 surgeries and 5 months of traumatic recovery. Most products, like the ones used on Dan, only provide a scaffold for tissue to grow into, but you need proteins to tell your skin to grow and to grow fast enough. We developed a super plaster that provides both, and it does it using your own proteins. Placed into the wound, our patented technology concentrates the body's own healing proteins and redelivers them with turbocharged efficiency. The result? 2.5 times faster healing as validated in preclinical studies. Dan's surgeries could have reduced from 10 to 4, his hospital stay from 5 months to just 2, saving him pain and the NHS £27,000. Dan's not alone. 9 million other patients in the US suffer from difficult wounds. Helping just half could save £121 billion. We are starting with traumatic wounds treated by reconstructive surgeons. Then we're expanding to chronic wounds. But we're not stopping there. Our patented technology can be adapted to heal other tissues like bones, hearts, and gums, opening up additional markets worth £2 billion. We will license our technology to wound care companies where we anticipate £100 million in revenue 5 years post-launch. I have already collaborated with a multinational wound care company to demonstrate the technology's potential. And we have 11 surgeons interested in using our product. WE Innovate has been a game changer. With the Boost grant, we attended conferences to make these connections, and after 50 patient interviews and 8 expert discussions, we developed a viable business model. I have been pioneering this technology since my undergrad at Imperial. Shani drives business operations, Sarah brings clinical expertise, and we are guided by experienced advisors. We just need a small helping hand in this pivotal time. With the 15K prize funding, we will validate our technology in 5 other dressings, unlocking key negotiations and major fundings for trials in 2026. Help us to revolutionize wound care and bring this to patients who needs it most. Because one day, it could be any of us. Thank you.
Welcome to your team, Sekmmet, joining you on stage for the judges' questions now. And for the judges' questions, Erica, to you first.
That was an outstanding pitch, so well done. So my question's a little bit of a tricky one, but I'm really genuinely interested in whether you've tested this on different skin types and what the impacts are on skins that keloid.
So actually, we did test it on multiple skin types. So firstly, we did it on mouse and live in vivo studies, but we also did it on ex vivo human skin across different ethnicities. So there is a range. It's still hard to say whether the difference we see is due to ethnicity or due to, it's a bit hard to say because there is a range from biological donors, but overall the trend we see is 2.5 times faster healing.
But then does it speed up keloiding, if you see what I mean? So if somebody is from an ethnicity where keloid scars are an issue, speeding up the healing process could mean that you increase the propensity to keloid. Has that been seen, tested, or is it just something that you haven't?
We haven't specifically looked for keloid scarring. So far, none of our wounds have healed to scar. That's to say, because we can only, for the ex vivo human skin, we can only keep it alive for 8 days in a lab, so it doesn't fully heal, but we compare how much it heals against its control groups.
Okay. Yeah. Thank you.
So your business model, you say, is to license. Mm-hmm. What have you done around patenting the technology to protect you when you license the technology?
So we already have a US patent granted and an EU patent pending.
Alexis.
Good answer and the right answer. So my question is a practical one. Is this designed to be applied in a clinical setting, so by a physician, only by a physician?
So Sarah is a plastic surgeon, so she will answer this.
Yeah, thank you for the question. So we're starting with traumatic wounds, where reconstructive surgeons will apply them in the surgical theatre. However, spinning out to chronic wounds, for example, other healthcare practitioners like nurses would be able to use them in an outpatient setting.
Okay, and then what's the optimal size for healing? I mean, the one that you had was like 2 to 3 inches. Have you designed it for different shapes, different sizes?
So for now, we've tested it on collagen sponges. Right now in the lab, we do small ones, which is 3 millimeter diameter, but we plan to raise funding for preclinical pig studies where it's going to be a much bigger model. Yeah.
Thank you.
Thank you very much.
Thank you.
Okay, and that brings us to our final team to pitch of the evening. Please give a very warm welcome to Pauline representing Routine Roo.
Welcome to Routine Roo, where children's routines become their favourite stories. Christina and I steered a SaaS business through a pandemic with operational excellence and emotional intelligence. But trying to get 3 kids out of the door without someone losing their absolute shoes, impossible. During our primary market research, we heard it all, from the hilarious to the heartbreaking, like Jade's family trying to adjust to type 1 diabetes. Clinical research confirms that routines are even more critical when there's additional needs in the home, like autism, affecting 3.3 million families in the UK and Ireland. So that's why we created Routine Roo. We combine proven behavioral science and the latest generative AI to create customized storyboards where kids and their families star in their own routines. Let's jump in and upload a photo. And the excitement begins. This is Ada, my youngest. She has never fallen asleep independently. We first fixed her chaotic bedtime routine from 2 hours to 20 minutes. And then we changed the last image to show me sitting at the end of her bed. This is a clinical technique called gradual separation, recommended for independent sleep with minimal distress. They say it takes between 4 and 14 days. 20 seconds in, Ada said to me, "You can go now." And just like that, my baby was sleeping independently for the first time in 3.5 years. And that is one happy mummy. It works because of the power of representation in learning materials. And because she had agency in designing her routines. We've had similar success supporting families with potty training, haircuts, and school transitions, all fuss-free. The parenting global app market will reach 5.5 billion by 2033. We will first target the 900,000 parents in the UK and Ireland, including those with special educational needs. The go-to system is PECS for therapists, but parents and clinicians are telling us it's rigid, it falls short, it's not gamified, and it's not personalised like Routine Roo. When we joined WE Innovate, this was just an idea we were obsessed with. Since then, we've spoken to over 130 parents. We've built and tested both digital and physical prototypes. We've started co-designing with parents and therapists. We've won awards, and we've raised over £40,000 in grant funding. We'll go to market with our Going to School boards in August, and we'll use the 15K to get us from MVP to production ready. We'll sell the boards at £26 for physical boards and £6 per month for digital subscriptions. We will, once we have 5,000 active users, we'll look to raise to fund our partner licensing model. We know how to run and scale a successful business. We've built a very strong advisory board to fill the gaps. Join us in supporting family well-being for better tomorrows, one routine at a time. Thank you.
Pauline, well done. Time for judges' questions. And Nigel, we start with you.
It's a great idea. But how do you protect it? How do you stay ahead? You know, because this is perhaps something that somebody else could replicate quite simply.
Yes, absolutely. I have over 20 years working in SaaS businesses, so I understand how hard it is to protect IT. So what we'll do is build our moats. So our moats will be the community that we are building with parents and clinicians who are going to be referring each other, helping each other. We will learn from the boards, and that community will be our first moat. The second will be the data that we're collecting. That data is going to be gold for learning about how kids learn, and how we can help them with behavioural issues and help them have happier, calmer lives. And that data will be our second moat, and that will be our biggest protection.
Alexis.
This relies on an iPad, or just can you talk about when, let's assume that you're looking for a child to develop a sense of agency around 3, is that about right?
So children between sort of 2 and 8, but
so
with different
2 and 8,
use cases,
developing a sense of agency. Would this be an iPad that you hand over to them and they pick and choose based on the pictorial timeline of what's next?
Yes, so there is a digital and a physical solution because we thought that parents wouldn't maybe want their kids to be on an iPad in the evenings. And we actually found in our market research that families with special educational needs have kind of got to the point where they're like, we don't want mess in our house anymore, just give us digital that we will always have. We don't have to bring things with us, it's just always there for a kid to engage with. So the parents will upload the pictures, the child picks the avatar that they most identify with, because that sort of like knowing that it's them is really important for engagement and the stickiness and for kids to get really bought into their own story. And so then like with the bedtime routine, you almost use it like a checklist. Have you done these things? And reward, wow, you're fantastic, that's brilliant. And it guides them along the routines in a positive way.
Okay, that brings us to time. Thank you very much indeed. Thank you. Okay, now that we've heard all of the fantastic pitches, it's time for our judges to leave us and deliberate. They'll be assessing each team's solution, growth potential, and expertise to decide who will be crowned the WE Innovate 2025 winners. In the meantime, we are going to take just a short break, 5 minutes. We'll be joined by Dame Alison Rose for a keynote speech at 7:35, so please make sure you're back in your seats by then. But if you need a bit of cool air, please do make your way outside, and you'll hear the bell to sound. Time to come back in. Thank you. Yeah. Welcome back. If I could ask you to please take to your seats as quickly and quietly as you possibly can. And thank you for making your way back into the room. I'm aware it's pretty warm in here, so appreciate you making your way back in so quickly after getting some much-needed cool air. Okay, welcome back to the final part of the evening, and it's my honour to introduce a true champion of change as our keynote speaker tonight. The first woman to lead a major UK bank. She shattered one of the highest glass ceilings in British finance as the CEO of NatWest. But her influence goes far beyond the boardroom. Through the Rose Review, she's reshaped the landscape for female entrepreneurs, driving real change and unlocking billions for the UK economy. And under her leadership, NatWest has doubled its support for women-led businesses and inspired a new generation of leaders. Please join me in giving a very warm welcome to our keynote speaker, Dame Alison Rose.
Thank you very much, and it's a real privilege to be here today, and I'm really delighted to be here at the launch of WE Innovate National. But most importantly, huge congratulations to all of the entrepreneurs who pitched. Those were incredible pitches, and I know how difficult it is to get your pitch into that short time and grab everyone. So huge congratulations and a big round of applause for our entrepreneurs. I'd also like to use the opportunity to extend my thanks and congratulations to Imperial College London and WE Innovate for their incredible contribution to supporting entrepreneurs through the WE Innovate programs over the last 11 years. And it's such an important step to see that now extended into WE Innovate National, so we're going to get coverage right the way across the UK and ensure that there is support for all entrepreneurs. So many thanks, and many thanks also to members of UKRI, the Invest in Women's Task Force, investors, founders, and all of the supporters of the WE National programme. Your support is so critical. I'm going to touch on why support for entrepreneurs is so vital. It's sort of an obvious thing to say, but it is an absolutely critical endeavour, and now more so than ever, as we look to stimulate the UK economy and cement our world-leading position as the home for innovation and entrepreneurship. The UK has an incredible engine room for business. It really is a powerhouse. And what is absolutely vital is we have a thriving pipeline of entrepreneurs to fuel that future business growth. And it is critical because it drives economic growth, it is real job creation, it stimulates tax receipts to ensure that we continue to contribute to the economy. And it also cements global growth from the amazing companies that we incubate, scale, and grow across the UK. It's important to remember that although a lot of global companies get the headlines and the high profile, in the UK, 60% of the economy is driven by small, medium-sized enterprises, and 50% of employees are employed by those SMEs and entrepreneurs. So we are a nation of entrepreneurs and small businesses, and if we do not have a thriving pipeline of new businesses starting up, we do not fuel that engine room of growth. Now, I've always been an advocate of supporting entrepreneurs. And the one thing I talk about constantly, and I talked about a lot in the Rose Review, that this really is a team support. It is absolutely incumbent on those people who can help to help. We need to put all of our support behind entrepreneurs to make sure we create the right environment, the right ecosystems, the right support network to ensure that entrepreneurship can survive. Now, during my time as CEO of NatWest Group, one thing that I was struck by was how little practical support there was in place for entrepreneurs and how hard it was to find that support. And some of the research that we did very early on was we found that 57% of people who actually wanted to start a business wouldn't do so because, firstly, fear of failure, and secondly, not knowing where to go to get help. And that is a massive deterrent to a really exciting opportunity that sits there. I also saw that the support was very variable, and in many cases, lack of information or access to capital meant that often for small businesses, they started up over-levering themselves with inappropriate debt, which stymies growth, or once they got going, they were giving away their equity too early and so missing out on the upside. And both of those sides of the barbell meant that we were stymieing the opportunity for real growth and acceleration. So one of the things I did was establish 14 free accelerators up and down the country to try and address the issue and create an environment where people could collaborate and support entrepreneurs. And when we got that going, what we found was that 47% of the entrepreneurs coming into our accelerators were women. We had no quotas, we had no targets. The people who came into the accelerators were selected based on their entrepreneurial mindset and their initial business ideas. And because of that collaborative supported environment, 40% of those businesses were still trading 2 to 3 years after startup, which was well above the national average. But having got these accelerators going and having got 47% of them as female entrepreneurs, what I found in talking to those female entrepreneurs was that their experience was incredibly different in terms of how they accessed funding and grew their businesses. And that really led to the creation of the Rose Review, which I researched and co-authored with the government. And this identified the problem and looked at, through a very data lens, best-in-class opportunities around the world. Where were female entrepreneurs getting better success rates, better access to capital? What was happening? And what we showed was that the data in the UK was incredibly stark and very disappointing. What it showed that less than 1% of funding was going to female-led business. And there was a significant level of underfunding and disparity of support for an untapped pool of talent and business ideas. And so if we could get to the same level that was being achieved in best-in-class countries such as Canada, the Netherlands, Australia, and the US, then the contribution to the UK economy was 250 billion. And at a time when we are looking for real growth and value, that is a huge amount of value just to ignore. The Rose Review identified 8 key barriers and practical interventions to help support female entrepreneurs and unlock that untapped value. Now, let me be clear, this wasn't about there being a lack of female entrepreneurs with brilliant propositions and ideas. Those female entrepreneurs were there, those ideas were there. But the barriers that they were facing was putting them at a disadvantage with less access to support and funding, as well as systemic barriers sitting within the investment community. Now, I'm pleased to say we made progress. On the back of those recommendations, we have seen improvements. When we did our last study of the Rose Review, 5% of VC funding was going to female-led businesses, so up from 1%, still massively too low, but progress. What was even better was we had 200 signatories in the Investing in Women's Code to highlight where you could go for support and help, and the establishment of dedicated funds and financing to support female-led businesses. We also saw, since the publishing of the first Rose Review, a 33% increase in the number of female-led businesses, and particularly in young women starting businesses. In the 18 to 24-year-old group, we saw a 6-fold increase in the number of women starting businesses. And a lot of that was stimulated by a Dream Bigger program, which I put into UK schools, trying to support entrepreneurs and teaching entrepreneurial skills. I sadly haven't yet managed to get entrepreneurship on the national curriculum, but that remains a wish on my wish list. But nonetheless, whilst there was good progress, it's still not good enough. There is still that 250 billion contribution sitting there to be unlocked. And the reality is progress has slowed over the last 2 years. So we need to now double down and press ahead if we are to unlock this value that is real. And let's be really practical. This is not altruistic in any way. This is real contribution to growth, a challenge we must all lean into in the UK. It creates jobs, it provides tax funding, it fosters innovation, and it cements the UK as the home for innovation and entrepreneurship, and that is something we absolutely must do. Now, a key aspect to continuing to deliver that is creating the right environment fiscally and an ecosystem that supports that. So the vital work that bodies such as the Invest in Women Task Force, the Women-led High Growth Enterprise Task Force, and many organisations, and particularly things like WE Innovate, are so vital to showcase the success and access support. So I'm delighted that the programme is now rolling out nationally, building on the success of WE Innovate. And this has had a real practical impact, helping over 500 women, 40 million raised, and some great examples of real success stories. Now, bringing together universities across the countries means we can scale this success story and drive greater impact nationally. We're able to bring together the benefit of our world-class educational facilities and lean into this opportunity. And selfishly, I'm going to plug one thing. I'm particularly delighted that Durham University, as an alumni of Durham University, the best place in the world to study, please don't boo me, to see them join this national movement and the fantastic investment they've made in their business school and support this programme. So, to close, welcome everyone to today's launch. It's another step forward in what is a critical endeavour for the UK, supporting amazing female founders, supporting amazing entrepreneurs. And what is really critical is to remember at the heart of every entrepreneur is an optimist. Having the belief and vision to start a new business and build and scale, that is hard, but critical work. And I'm always in awe of the passion, resilience, and drive it takes to do this. So thank you and congratulations to all of you. But the broader significance of the work they do, the huge value and contribution they add to our country and its success is vital. The UK remains the best place to start and scale a business, but we cannot expect these amazing entrepreneurs to embark on this journey alone, and that is why we have to lean in and help. So no pressure to the entrepreneurs in the room, but you are the future of the UK economy. Your vision, your passion, your resilience and drive are what will not just make you a success, but will breathe growth into the economy, creating jobs, contributing to the economies and communities where you live and work. And the commitment of everyone here today is to do everything we can in our power to support you on your journey. Because the UK needs a thriving entrepreneurial community, an environment where people can start and scale businesses, where access to support is easy and clear so that entrepreneurs can focus on the hard job of creating businesses and jobs and value for our economy and cementing our historical position of the place to lead businesses. So good luck today to everyone. I think all the pitches were amazing. I think all of your businesses are investable and relatable. I wish you every success in the competition today, but I look forward to watching and following your success as you continue to build and scale your businesses. So congratulations and good luck. Thank you, everyone.
Thank you very much indeed to Dame Alison Rose. Okay, it's almost time to announce tonight's winners of our grand prizes, and I'm really thrilled to, before then, announce the winners of our semi-finalist awards, some additional prizes. And I'd ask that you join us in giving each winner a round of applause for our exceptional prize recipients, who I know are in the room but won't be joining us on stage this evening. So first up, with our additional prizes, please give a very large round of applause to the winner of Imperial College London's Leadership Award, Elise Marshall of Team EvoTouch. And moving on, and jointly winning the Queen's University Leadership Award is Maeve McCaffrey-Lau with the Startup Future Ready Lab, and Ruchira Rangaprasad from the startup Balantra. Well done. Okay, next to the winners of a 6-month business coaching package through the Lauren Dennis in Memoriam Award is the startup Conclude. And to the joint winners next of the Queen's University Business Coaching Award, Kinder Studio and Apta NutriFoods. Well done. Our penultimate additional award, supported by the Engineers in Business Fellowship and awarded a £3,000 equity-free grant. And the winners of the Engineers in Business Prize is OmniHuman. Finally, I'm delighted to announce the winners of the Queen's University Special Recognition Award, Live Technologies. Okay, now for the moment you have all been waiting for, the announcement of the grand prize winners. And I'd like to invite our esteemed judging panel to join me on stage to award each of our winners. I shall shift over a little bit to give you space. And I'll invite our judges, thank you, to join us at the front of the lectern. So, quick reminder, our judges have been scoring the teams based on 4 key criteria: innovation, growth potential, team expertise, and plans to scale. And after careful deliberation, I'm pleased to say they've now reached their final decision. So let's start with the 5th runner-up prize from Queen's University, Belfast. I'm delighted to announce in 5th place, it's CME. Congratulations to CME, our 5th prize winners from QUB, taking home £1,500 in equity-free grant funding. Well done. And next, the 5th runner-up prize from Imperial. Delighted to announce that in 5th place, it's Reporty. Congratulations to Reporty, again receiving a £1,500 equity-free grant funding. Moving on to the 4th runner-up prize from Queen's University, Belfast. Please put your hands together for IASO Solutions. And huge congratulations to IASO Solutions from Queen's University Belfast in 4th place, awarded £1,500 in equity-free grant funding. The 4th runner-up prize from Imperial College London, I'm delighted to announce, is ClearXview. Huge congratulations, also receiving £1,500 in equity-free grant funding. And that brings us to our 3rd prize from Queen's University Belfast. I'm delighted to announce in 3rd place, Innovcope. Many congratulations to Innovcope, our third prize winners receiving £5,000 in equity-free grant funding. And our third place winners from Imperial, please put your hands together for Luna Bio. Many congratulations to Team Luna Bio from Imperial receiving £5,000 in equity-free grant funding. Congratulations, well done. Well done. Moving on to the winners of our second prize now, and I'm delighted to announce that in second place from Queen's University Belfast, it's Routine Rue. And huge congratulations, Routine Rue, taking home £7,000 in equity-free grant funding. And the winner of the second prize from Imperial is Sekmmet. Sekmmet, our second prize winners from Imperial, also receiving £7,000 in equity-free grant funding. And by your powers of deduction, I think you can probably work out who our first place winners are. But it is time for our grand final prize winners. And I'm delighted to announce that from Queen's University Belfast, it's Dainty Grace. Many congratulations to Dainty Grace, our WE Innovate first prize winner, receiving £15,000 in equity-free grant funding plus a legal support package valued at £3,000. In first place from Imperial, it's Aeropod. And huge congratulations to Aeropod, winning £15,000 and a legal support package worth £3,000, generously supported by Mitchell Moores. Congratulations to you all, and I'd like to thank our judges, who will now take their seats again. That just leaves me time to say thank you very much indeed to you all for joining us here at WE Innovate 2025. Well done to the 2025 cohort. A huge thank you to our fantastic judging panel, and a special mention for our generous donors and supporters, including Alison Bennington, Mitchell Moores, Richard Himwood, the Althea Foundation, and the Engineers in Business Fellowship. I'd ask for a round of applause for them all enabling today to happen. Now, if you or someone you know is interested in supporting the national expansion of WE Innovate, we ask you to speak to a member of the team who you will find at the networking reception by the Enterprise Lab banner. You can't miss it. And this is a fantastic chance to change the landscape for women entrepreneurs in the UK. And if tonight has inspired you and you think you might have the next breakthrough innovation, why not apply for Imperial's Venture Catalyst Challenge? Applications are now open. So I'd now like to ask for our winning teams and our judges to stay seated in the lecture theatre for photos. But for our audience, thank you very much indeed for joining us. If you could make your way out to the networking drinks through the doors at the back of the lecture theatre, and join us in the college main atrium. Thank you very much indeed. Enjoy the rest of your evening.